I have a genuine question for the nurses of TikTok, or the nurse managers, the nurse educators of TikTok. And it's going to sound like I'm trying to start a controversy. I'm really not. I'm really trying to understand this because I don't. And I've asked a lot of people in real life and nobody has given me an answer that I feel satisfied with. But why is it that in the nursing world, ER nurses are not considered to be providing critical care? I don't understand that. Like, my wife and I were just passively kind of looking at different options for nurses, and we came across the requirements for CRNA, right? And they say you need XYZ amount of years doing critical care, and then literally in parentheses it says ER doesn't count. And I don't understand that. Maybe I just have this bias because I'm an ER doctor, but it doesn't make sense to me. I'm an ER doctor, but I have worked in medical ICU, I've worked in surgical ICU, I've worked in cardiovascular ICU, trauma ICU, PICU, NICU. I had to rotate through all of those units when I was in residency, right? That's part of becoming an ER doctor. And I've worked with nurses on all of those units. And obviously I work with nurses every day in the ER. And it kind of blows my mind that ER nurses are not considered to be doing critical care. Like, every critical patient that comes into the hospital critically ill is first at least partially stabilized by the ER nurses. And it's wild because in the ER, the nurses have more autonomy than in any other unit. Like, the ER nurses are practicing medicine pretty much. Like, if the doctor hasn't showed up yet, they are stabilizing the patient. Like, there are ER nurses who run codes better than some of the doctors that I've worked with. How are they not considered to be providing critical care? And I've asked people this in real life, and I've heard things like, well, it's because not all of their patients are critical. I would argue that if you can take care of critical patients while also taking care of non-critical patients at higher ratios than you would be doing critical care in the ICU, that's a special skill set of its own. And dealing with all the family members, we don't have visiting hours. Dealing with, a lot of crazy things. The ER nurses get assaulted at higher rates than nurses in other units. And just, I would argue that they're doing both critical care and non-critical care, which is, to me, impressive. I would also argue that not every patient in the ICU is critical either. And I know at the bigger hospitals, yes, I worked at level 1 traumas when I was in residency, and those patients, as soon as they blinked an eye, they had to get transferred out because they needed the space. But at a lot of the smaller hospitals that I work at now, people stay in the ICU for longer than they need to. There's a lot of non-critical patients in the ICUs at many of the hospitals that I work at. I've even been asked in the ER to upgrade patients when I admit them because the census is low in the ICU and they don't want to send nurses home, which is not supposed to happen. I don't upgrade patients, but I would argue that not every patient in every ICU is critical either. So there's that. I've also been told that the reason ER isn't considered critical care is because it's not long-term, that patients get stabilized for a few minutes and then they go upstairs. That's not the case at most hospitals. If you work in a hospital where that happens, you work in a really nice hospital. But most of the places that I work, the ICU patients are boarding in the ER for hours, sometimes more than 24 hours. The ER nurses are managing the vents, managing the drips for their entire shift. Like, they are providing critical care for hours at a time while doing other things, managing other patients. Like, a very large amount of time, we're sending patients up to the ICU and they're almost ready to be transferred out. Like, if your patient's been in the ER for 12 hours on an insulin drip, their DKAs, their gap's probably closed by now. They're probably better. I'm really struggling with this concept. I also think it's crazy that the ER sees so many patients who are so critically ill that they never even make it to the ICU. Like, how many times are they coding people that don't make it to the ICU? How many times do they get traumas that are so severe that we're cracking chests in the ER and they're not making it to the ICU? I would argue that if your patients are so sick that they're not making it to the ICU, those are critical patients. I just struggle with the concept because as an ER doctor, I am providing critical care in the emergency department. Every time I sign off on a patient's chart, I have to document the specific number of minutes that I spent providing critical care on this patient. But my nurses aren't considered to be providing that same level of care that I am. I would argue that they're doing more than I am. They're taking care of those patients for longer because once I admit the patient, they're still taking care of them and I'm not. So how are they not doing critical care? I need somebody to make this make sense. I know that I probably have a bias because I do work in the ER. I love my ER nurses. But I feel some type of way about this. Like, I feel upset about the fact that these nurses who I work with every day, who I trust with my life, I trust with my license. Honestly, these are nurses, many of them who've been working longer than me. I look up to them and I learn from them every day. And I feel some type of way about them saying that those nurses are not providing critical care. Because they are.